Hello and welcome to this video about male pattern baldness. Expect to learn what the underlying biological processes are that drive male pattern baldness, what effective evidence-based treatments we have for it, and which ones of these might be worth your money. Right, what is male pattern baldness, or MPB, and how does it come about? MPB is one of two conditions sitting under the umbrella medical term androgenetic alopecia, or hair loss driven by male sex hormone. In men, the MPB characteristic profile is that hair thins and then disappears from the temporal regions, creating an M-shaped hairline and over the vertex or crown, whilst remaining relatively thick elsewhere. By contrast, female pattern baldness tends to involve a global thinning out with no predominantly badly affected regions and no regions spared either. To understand why, we first have to understand that our hairs are always somewhere along a process called the hair growth cycle, which is influenced by both genetics and hormones. Now, the hair growth cycle consists of 4 phases and is played out over and over and over again in lots and lots of small growth beds or hair follicles across our scalp and our bodies. Now, phase 1 is lengthening. This is the growth phase, or anagen. Phase 2 is separation, or catagen. It involves the shifting of the hair from the base of the hair follicle or bed onto a stalk, allowing the next hair to begin its growth. And then the hair follicle enters the pause phase, or telogen, before being shed in what is called exogen. This is an entirely normal and repeated process, with the only variable being the length of time spent in the pause phase, telogen. The hair follicle then repeats this process again and again for the entirety of our lives. Now, these hair follicles or hair beds contain hormone receptors that make them susceptible to the influence of a hormone called dihydrotestosterone, or DHT for short, but the effect of DHT is neither universal across our body nor in time. Some hair follicles grow weaker in response to DHT exposure over time, and others, such as those on the male jaw, tend to be strengthened by the same exposure. Others still remain somewhat indifferent. The withered hair follicles continue producing hairs that are ever thinner until eventually they reach a point where these hairs are so small and feeble they no longer pass beyond the surface of the skin, and now the baldness process is complete. Now, we need testosterone for lots of things, but we have isolated the enzyme 5-alpha reductase that converts it to dihydrotestosterone. This lends itself as a target for the treatment of male pattern baldness, as we will look into shortly. The other target is simply to try alternative strategies for revitalizing these hair follicles to enable them to produce healthy hairs in the future, despite the ravaging effect of DHT. We'll explore that too now. Now let's talk about those treatments. In the modern West, we currently have 4 treatments for male pattern baldness, and we'll go through the good, the bad, and the ugly of these in no particular order. First, the medications, minoxidil foam and/or finasteride tablets. Let's do minoxidil. This medicine is typically prescribed as foam applied directly to the scalp and is a potent vasodilator or artery wall relaxer that increases blood flow to the area. If you were to take it orally, it might crash your blood pressure, hence most people rub it in on the scalp. Very few do so in sufficiently high quantities that the small fraction that spreads throughout the body causes much of a problem elsewhere. It works by strengthening blood flow and delivery of nutrients to the hair follicle. This enhances all stages of the hair growth cycle, so it can cause a paradoxical and alarming short-term initial stage of additional hair shedding. Next, finasteride. This is the only treatment on the list that directly targets the hormone DHT implicated in driving the process. It does this by blocking the action of the converting enzyme 5-alpha reductase that would normally facilitate testosterone's conversion into DHT. Now, as this medication is only available as a tablet outside of India, where it's also available as a foam, we can expect it to drive down the concentration of dihydrotestosterone, not just in the scalp but everywhere else in the body, In men, this can lead to an unwanted basket of side effects, including altered mood, reduced sex drive, and erectile dysfunction. But it can potentially be much worse if taken by women of reproductive age, because DHT, or dihydrotestosterone, plays a very important role in the sexual differentiation and development of the developing fetus. Still, it's a popular medication because it's reasonably priced and works reasonably well too, and the side effects are rare. Now, how effective are these medications? Well, one study linked down below found over 1 year significant hair regrowth in 80.5% of people taking finasteride and 59% of those taking minoxidil foam. And 94.1% of participants who took both the finasteride and the minoxidil were found to have significantly better hair growth after 1 year. Next, on to red light therapy, or low-level laser therapy. This is evidenced specifically at the 650 nanometer wavelength, or infrared range, with 2 products having already gained FDA approval for this use. They're effective, with the study evaluating the HairMax laser comb, finding that people using this product for 6 months increased normal hair density by 19 hairs per centimeter on average, whereas study participants in the sham therapy group lost on average 7 hairs per centimeter. These study results have been replicated by another team with another red light device, but both studies are weakened by the criticism of conflicts of interest, namely they were funded by the companies supplying the products. Still, this method is safe for pretty much everyone so long as you're not also taking a medication that makes your skin highly susceptible to light reactions and avoids the side effect profile potential of medications. And finally, hair transplants. A much coveted procedure with apparently 700,000 people undergoing one in 2022 alone. Most hair transplants are follicular unit extraction transplants, whereby whole healthy hair follicles are harvested from an area of the body where they are not found to be sensitive to the withering effects of DHT and implanted onto the scalp. This procedure has the upsides of potentially being very long lasting and carrying the potential to restore a full head of hair to someone with very pronounced hair loss, but it comes with the potential downsides of a small risk of skin infection due to the procedure, a hefty price tag, and the possibility of inadvertently creating islands of healthy hair with male pattern baldness continuing unabated elsewhere on the scalp. That's all for today's video. Thank you for watching, and if you haven't already, please consider subscribing to the channel.